My name is Dr. Sarah Martinez, and I've been a diagnostic radiologist specializing in obstetric ultrasound for 14 years. I work at Valley Women's Medical Center, where I perform approximately 30 to 40 pregnancy scans per week. I've seen thousands of developing babies, diagnosed countless conditions, and guided expectant parents through both joyful and difficult news. I thought I'd encountered every possible variation of human development. I was terrifyingly wrong. The case that haunts me began on a rainy Thursday morning in September when Lisa Chen, a 28-year-old software engineer, came in for what should have been a routine 20-week anatomy scan. Lisa was a first-time mother, and she'd had an uncomplicated pregnancy so far. Her previous scans at 8 and 12 weeks had shown normal fetal development, and her blood work had come back perfectly healthy. She arrived with her husband David, both of them excited to learn the baby's gender and see detailed images of their developing child. I began the scan as I always do, applying gel to Lisa's abdomen and starting with the standard measurements. Immediately, I could see a healthy fetus in the normal position within the uterus. The baby appeared to be developing appropriately for 20 weeks, proper limb formation, normal heart activity, and good amniotic fluid levels. Everything looked textbook perfect, and I was about to congratulate the parents on their healthy baby girl when I noticed something else on the screen. There was a second mass visible in the scan, but it wasn't positioned where you'd expect to see a twin. This structure was located behind Lisa's uterus, attached to her spinal column at approximately the L3 vertebra level. At first glance, it looked like it could be a large cyst or tumor, but as I adjusted the ultrasound settings for better clarity, I realized it had organized internal structures, what appeared to be a primitive cardiovascular system and developing tissue that looked disturbingly similar to fetal organs. Twist number 1. The parasitic twin. I spent nearly an hour examining this second mass, taking measurements and trying to understand what I was seeing. The structure was roughly the same size as the normal fetus in Lisa's womb, but its development was completely different. Instead of the organized, symmetrical growth pattern of a typical fetus, this entity had an asymmetrical, almost chaotic arrangement of organs and tissues. It had what appeared to be multiple primitive hearts beating in different rhythms, tissue masses that resembled brain matter, and appendages that didn't conform to normal limb development. Most disturbing was its positioning. It seemed to be connected to Lisa's nervous system through neural pathways that extended from her spinal cord directly into the mass. I'd never seen anything like it in medical literature, but it reminded me of cases of parasitic twins, where one fetus becomes dependent on another during development. Except this wasn't attached to the healthy fetus, it was attached directly to the mother's spine. Twist number 2. Independent movement. As I continued the examination, I noticed that both the normal fetus and this spinal mass were moving independently of each other. The healthy baby was displaying typical fetal movements, kicking, turning, grasping with her hands. But the spinal entity was moving in ways that seemed more purposeful and coordinated than normal fetal movement patterns. When I would move the ultrasound probe, the mass would shift and reorient itself as if it was aware of being observed. During one particularly clear view, I observed what looked like primitive eyes within the mass turning toward the ultrasound probe. The movement was too deliberate to be random fetal activity. It appeared to be tracking the source of the sound waves, following the probe as I moved it across Lisa's abdomen. When I mentioned this to Lisa and David, they said they'd been feeling two distinct types of movement for weeks. Normal baby kicks in front and strange sensations along Lisa's back that felt like something was crawling along her spine. Twist number 3. Neurological connection. I recommended an immediate MRI to get better visualization of the spinal mass and its connection to Lisa's nervous system. The MRI results were unprecedented in my experience. The entity was not just attached to Lisa's spine, it had actually integrated itself into her central nervous system. Neural pathways from the mass were intertwined with her spinal cord, and brain scans showed unusual activity in regions that typically remain dormant during pregnancy. More alarming was the discovery that Lisa's brain was showing dual patterns of electrical activity, her normal brainwave patterns, and a second set of signals that seemed to originate from the spinal mass and travel up through her nervous system. It was as if she had two separate consciousness existing within her body simultaneously. When I asked Lisa if she'd experienced any unusual thoughts or sensations, she became visibly uncomfortable and admitted she'd been having dreams while awake. Vivid experiences of seeing through different eyes and thinking thoughts that didn't feel like her own. Twist number 4. the feeding relationship. Blood work revealed that Lisa's nutritional levels were severely depleted despite her maintaining a healthy diet and taking prenatal vitamins. Her iron, protein, and calcium levels were all significantly below normal ranges for a 20-week pregnancy. However, the spinal mass was showing rapid growth and development, suggesting it was somehow drawing resources away from both Lisa and the normal fetus. Doppler ultrasound showed that the entity had developed its own complex circulatory system that was directly connected to Lisa's major blood vessels. It wasn't just sharing her blood supply, it had essentially hijacked portions of her cardiovascular system to prioritize its own development. The normal fetus was receiving adequate nutrition, but Lisa herself was being slowly drained by this parasitic relationship. Twist number 5. Communication attempts. During our third ultrasound session, something happened that made everyone in the room freeze with terror. As I was examining the spinal mass, it suddenly became extremely active, moving rapidly and what appeared to be attempting to manipulate its primitive limb structures. On the screen, we could see it positioning what looked like finger-like appendages against Lisa's spine in a rhythmic pattern. 3 taps, pause, 3 taps, pause, repeated consistently for several minutes. Lisa suddenly grabbed my arm and said, "It's trying to tell us something. I can feel it tapping against my back, and somehow I know it wants us to understand." She described experiencing flashes of images and emotions that didn't belong to her, visions of darkness, a desperate need to grow and develop, and an overwhelming desire to be born. The entity wasn't just aware, it was actively trying to communicate its needs and desires through its connection to Lisa's nervous system. Twist number 6. The normal twins' response. Perhaps most disturbing was how the healthy fetus began responding to the presence of the spinal entity. During our monitoring sessions, we observed that whenever the spinal mass would become active, the normal baby would move to the farthest position possible within the uterus, as if trying to get away from something. The healthy fetus's heart rate would spike whenever the spinal entity showed signs of increased activity. On several occasions, we witnessed what could only be described as aggressive behavior from the normal fetus toward the spinal mass. Using ultrasound, we could see the baby kicking forcefully toward the back of the uterus, as if trying to attack or defend against the entity attached to her mother's spine. Lisa reported feeling these episodes as intense back pain combined with unusually violent fetal movements that would last for hours. Twist number 7. Accelerated development. By Lisa's 24th week of pregnancy, the spinal entity had grown to nearly the same size as the normal fetus, but its development was following an impossible timeline. While the healthy baby was developing at a normal 24-week pace, the spinal mass was showing organ development and neural complexity that should have taken months longer to achieve. Its primitive brain structures were more developed than the normal fetus, and its cardiovascular system was more complex and sophisticated. Twist number 8. The conscious decision. As we approached Lisa's 28th week, the situation became critical. Lisa's health was deteriorating rapidly due to the nutritional drain from the spinal entity, and there were signs that her nervous system was beginning to be damaged by the foreign neural connections. The normal fetus was also showing signs of developmental stress from the competition for resources. During what would be our final ultrasound session, something extraordinary and terrifying happened. The spinal entity, which had been growing steadily for months, suddenly began to withdraw from Lisa's nervous system. On the screen, we could actually watch as the neural connections started to sever themselves, and the entity's growth slowed dramatically. Through her connection to the mass, Lisa reported receiving a final message, an overwhelming sense of sadness and resignation, as if the entity had made a conscious decision to sacrifice its own development to preserve Lisa and the normal baby. The medical team I consulted was divided on how to proceed. Some recommended immediate surgical intervention to remove the spinal mass, while others argued that its integration with Lisa's nervous system made surgery too dangerous. But before we could make a decision, the entity began to break down on its own. Over the course of a week, it gradually dissolved and was reabsorbed by Lisa's body, leaving behind only scar tissue on her spinal column. Lisa delivered a healthy baby girl at 38 weeks with no complications from the pregnancy. The delivery was completely normal, and there were no signs that the spinal entity had ever existed, except for small calcified deposits along Lisa's L3 vertebra that showed up on post-delivery X-rays. Lisa's neurological function returned to completely normal within a month of delivery, and she reported no more unusual dreams or foreign thoughts. But the case left me with more questions than answers, and I've spent the past 4 months researching similar cases and trying to understand what we witnessed. I've found scattered reports in medical literature from various countries describing similar phenomena. Parasitic masses attached to pregnant women's spines or nervous systems, always showing signs of independent consciousness and always seeming to make deliberate decisions about their own survival. Based on my research and what we observed with Lisa's case, I've developed a theory about what might cause these entities to develop, though I acknowledge it's largely speculative. I believe it may be related to electromagnetic fields and radiation exposure during the critical early weeks of pregnancy when the nervous system is first forming. Lisa worked as a software engineer in a building with extensive wireless networking infrastructure, 5G cell towers on the roof, and dozens of high-powered computer servers. She spent 8 to 10 hours per day in this environment during the first trimester of her pregnancy, when fetal neural development is most vulnerable to external influences. I think it's possible that intense electromagnetic radiation during this critical period could cause neural stem cells to develop independently of normal fetal development patterns. The entity's apparent consciousness and ability to integrate with Lisa's nervous system suggests it developed from neural tissue that was somehow activated by electromagnetic exposure, but grew outside the normal developmental framework. This would explain why it was so neurologically advanced yet physically chaotic. It had the neural complexity for consciousness, but not the organized development pattern of a normal fetus. My advice to any pregnant women reading this: be extremely cautious about electromagnetic field exposure during your first trimester. Avoid spending long periods in buildings with extensive wireless infrastructure, keep your distance from cell phone towers, and minimize use of high-powered electronic devices. Don't work in server rooms or data centers during early pregnancy. The developing nervous system may be more vulnerable to these influences than we currently understand. I also recommend requesting additional spinal imaging during routine pregnancy scans if you experience any unusual back pain, strange sensations along your spine, or feel movement patterns that seem different from normal fetal activity. Early detection might be crucial if something like this is developing. While the medical community doesn't officially recognize electromagnetic fields as a risk factor for abnormal fetal development, the cases I've found suggest there may be a connection we don't fully understand yet. Until we know more, it's better to be cautious than to risk experiencing what Lisa went through. I still perform ultrasounds every day, but now I always check the spinal area carefully, and I've started asking all my patients about their work environments and electromagnetic exposure during early pregnancy. Because somewhere out there, other women might be carrying entities that are aware, conscious, and making their own decisions about whether to grow or die.